So we are one of the leaders of personalised precision medicine in the NHS because we've been dealing with patients and drugs that they take and in adding technologies that are coming through to integrate all of that so that we can actually improve the way we use medicines in the NHS for patient benefit. It's important because we use £16 billion a year on the NHS drugs budget. If the drugs that we prescribe don't work even in a third of patients, then we're wasting all that money. We know that drugs also cause adverse drug reactions. At least 8,000 beds in the NHS are occupied by patients with adverse drug reactions right now. We need to be able to reduce that burden. If we can improve the efficacy of drugs we use, reduce the burden of adverse drug reactions, we can save a lot of money for the NHS, as well as actually making patients feel better. So one area that we've started recently is really looking at kidney failure occurring through the use of drugs used for heart failure. For example, diuretics, ACE inhibitors. We know that those drugs can cause kidney failure, but at the moment there is no guidance to be able to when you should measure a patient's kidney function. So what we're using are big data approaches. We're taking data that's available nationally through databases. We're then using novel techniques, artificial intelligence, to work out what the renal functioning monitoring schedule should be, personalized to that particular patient. So a patient of 82 on 80 milligrams of furosemide may need renal function monitoring every 6 weeks, while somebody who's younger may need it every 6 months. So we can actually have that personalized renal function monitoring. But more excitingly, we're also working with innovative companies which are developing new technologies which will allow us to monitor renal function through Fitbits, for example, or bands that you can wear or patches you can wear on your skin without having to take a blood test. And that will then be linked to the patient, to their mobile phone, or to the GP. And that kind of innovative technology will mean that we'll be able to monitor patients' blood streams for kidney function on a routine basis, on a continuous basis, and that will be fantastic information for the patient, information for the GP. The net aim of this is to make patients' lives healthier and to prevent them from being admitted to hospital with kidney failure. The actual algorithms for renal function monitoring will happen very quickly, hopefully within the next 12 to 18 months. In terms of actually having the bracelet or patch you wear, that might take slightly longer, probably 3 years or so. But even if you don't have that bracelet, you can then actually have those algorithms, and you can go to your local doctor, you can go to your hospital, have your blood tested conventionally, and have that benefit already. So in the next 12 to 18 months, we'll have those algorithms, but having the bracelet or the patch, which actually monitors the kidney function, may take slightly longer, but nevertheless, it is moving along.